Hello, my name is Dr. John Heather and I'm a GP in Weston-super-Mare. This coronavirus took us all by surprise. Very quickly, we've had to significantly and substantially rearrange the way that we offer our services. That's meant a lot of change, and so over the next few minutes, I'd like to give you an insider's view as to what it's been like within general practice over the past few months. The first and most obvious change has been digital first. By that I mean we now encourage patients to interact with our services firstly either by the internet or by phone rather than attending the practice face to face. Actually within Weston that wasn't such a big change because already 6 of the 9 practices had chosen to use Ask My GP as their preferred means of interacting with patients. And now because of the coronavirus, all 9 practices within Weston and Well are actually using Ask My GP. The beauty of this system is that it allows us to see immediately the volume of calls that we're receiving, the urgency of them, and also whether or not we can actually direct a call to somebody other than a GP who's better suited to meet that need. For example, someone else in the extended primary healthcare team, for example, a physiotherapist or a mental health worker or a pharmacist or a social prescriber. What it actually means is that we can get your call to the right person first time, which then means that we can enable anybody that needs to see a GP face-to-face is able to do so. One of the other things that we did was to connect our practices much more digitally together, which meant that early on in the pandemic, when one of our practices had a number of their prescription staff go sick, we were actually able to divert that work to other practices, meaning that no patient within peer was inconvenienced. Very early on in the pandemic, we started to have daily Zoom calls where a practice manager and some clinicians from each practice were there alongside some individuals from the CCG and also some senior managers from the local community provider Sirona. This was an opportunity for us to talk about any problems within the practices, any pressures that we're under, to update ourselves on the latest government guidance, and at times it enabled us to spot some weaknesses and to share staff across the organisations. Care homes have not been out of the press very much, and within the CCG area every care home now is allocated to a particular practice, and within that practice there is a lead clinician dedicated to that care home, usually but not exclusively a GP. And each of those care homes has a virtual weekly ward round. There is no better example of the collaboration between us and Sirona than when Weston actually hit the headlines for the very worst reasons in early May, when Weston Hospital had to close because of coronavirus outbreak. At that point, the CCG asked the 2 organisations whether they could stand up at short notice a reception area in the grounds of Weston to look after any patients that turned up, not realising that the A&E department was shut. With the help of Sevenside, the out-of-hours provider, and the ambulance service, we were able to do that. And for 2 weeks, we ran a very safe and effective service, which enabled the hospital to get on and sort out the outbreak, knowing that we had their back. So it's been a challenging few months. I hope you can see that one of the beauties of general practice is that we are both resilient and innovative, and that's enabled us to cope. And going into the winter, which I'm sure is going to be a challenging time, we're going to be able to do the same. And we're going to be able to ensure that our services continue, and that actually when you need to see a GP face to face, you'll be able to do so. Thank you for listening.